Up until now, there's only been one paediatric critical care unit down in Brisbane, and one has just recently opened up at the Gold Coast. So any child within the whole of Queensland who needed critical care services had to travel to Brisbane. So what we've done is we've opened up a satellite unit in partnership with LCCH, and so for the kids who don't need highly specialised care, they can be treated here if they've got a critical illness and not have to travel and have all that inconvenience for the families. And it's a really stressful time for parents to have a sick child, so if you don't have to do all of that other stuff like moving and being down in Brisbane, then that helps.
This is Malachi. He is 8 weeks old. We started off at Lady Salento. We were there for 3 weeks because he has pertussis. And then we got transferred to here, and we've been here for 3 weeks as well.
In Brisbane they have all the tertiary level services, so if you need a paediatric neurosurgeon or a paediatric cardiovascular surgeon, then you need to go down there because those highly specialised services are down there. But what they found since LCCH opened is that there are a lot of common critical illnesses like pneumonias and bronchiolitis that don't need those highly specialised services but are still going to Brisbane, and actually that's having an impact on their capacity issues. So for us to be able to treat those common problems that need a critical care unit but not the highly specialised side of things means that parents and patients can stay closer to home.
It actually makes you feel like it's a home here. The nurses make you feel like welcome, and they're really friendly.
Most parents will travel anywhere providing their child gets the care that it needs at that time. But if the care is equivalent, which is what we are offering at the lower level of complexity, then other things become important. Like most parents will have more than one child, so they'll have siblings at home that they also need to get to school, also need to look after at the same time as having a child in intensive care. Most parents will also both work, so you've also got being pulled in other directions. So I think it's really important to be close to home to be able to do that. And a lot of families will have extended family in a close proximity as well. So grannies and aunties and uncles that can lend support will often be in a close proximity too. So it's important, I think, to offer the same level of care for these children here.
At the moment, he's getting a lot better, so he's just needing like a bit of one-on-one care and oxygen when needed when he's having some bad coughing fits.
So we opened with 2 beds because you've got to open in a stepwise manner and make sure that the service that we're offering actually is risk-free and that it is at the same level as Brisbane, and we've managed to prove that with our first 100 patients. And now we've got to look at what the demand is going to be over the rest of the year. We're looking like we're probably doing more work than we thought we would be doing, and if we compare ourselves to Gold Coast, they thought they would open with 200 patients a year, and they ended up with about 350, and I think we're probably on track for a similar thing.